Depending on one's socioeconomic status, their access to resources and the availability of opportunities for improvement can be quite varied and at times inequitable. A person's socioeconomic status is generally based on three components: their level of education, their profession, and their income. Currently in the U.S., it is our social practice to divide people into three specific classes or levels. The first class is called poverty. According to an article written by David Francis and published in 2012, 15% of the U.S. population, which at the time was roughly more than 46 million people, were living below the poverty line. The poverty line is a calculated figure and at the time was an annual income of $23,050 for a family of four. This is the amount of income a family would need to afford the bare essentials of living. The next class is the broadest because most Americans fall into this class, which is known as the middle class. The middle class is then broken down into three distinct levels. The first of which is the working class. This level is at the lowest end of the spectrum and has an income of $23,051 to $32,499 per year. A person in this class generally works in a blue-collar industry or is paid by the hour, such as working for a fast food chain or a retail store. They also tend to have lower levels of education, such as a high school diploma or some college education which has not been completed. The next level is called the lower middle class, which falls in the middle of the spectrum, and the income range is $32,500 to $60,000 per year. A person in this class typically will have a college education but lacks an advanced degree. They may work in lower-level white-collar positions. The final level is called the upper middle class or the professional class, and it falls at the top end of the spectrum. The income in this level can exceed $100,000 per year. A person in this class tends to have a postgraduate degree and may work in high-level white-collar positions. The next class is called the upper class, which is broken down into two categories. The first category is commonly referred to as the 5%, which essentially means the percentage of Americans who earn more than $150,000 per year. And at the top of the economic ladder are what is known as the 1%, which is the percentage of households that earn more than $250,000 per year. There are several factors in one's life that can be affected by their socioeconomic status. Such factors include physical health, psychological health, educational outcomes, and family stability. First, let's look at physical health. People with a lower socioeconomic status are less likely to have yearly early detection tests performed. They may not be able to afford health insurance, they may not be able to pay their medical bills, and they may not be able to afford the transportation to get to and from medical appointments. Another thing to note is that children in this group tend to be born with low birth weights. There are also avoidable hospitalizations, avoidable procedures, and untreated diseases. Psychological health. Those with a lower socioeconomic status tend to have higher psychological distress. The children in this group are exposed to more alcohol and tobacco advertisements and drug distribution, thus increasing the likelihood of drug use. They also tend to exhibit antisocial behaviors. The diagnosis of schizophrenia is higher in both Caucasians and African Americans in areas of poverty. African Americans and Latinos in low poverty areas are at higher risk of being committed involuntarily for psychiatric care. Educational outcomes. Schools in these areas lack the valuable resources needed to offer rigorous curriculums, and the teachers may expect less from their students academically. Family stability. Because these families have more exposure to substance abuse, there is a higher rate of child abuse and/or neglect. Low socioeconomic status has been linked to domestic overcrowding, which can have negative effects on everyone, including increased stress and poor health outcomes. Another concern is those with low socioeconomic status is that they are more likely to be victims of violence. Social justice comes about with social change and has a goal of creating a society or institution that is based on having equality for every human being. Occupy Wall Street was a social justice movement that began in 2011 to protest corporate influences on politics, voice outrage at the lack of legal consequences for the bankers involved in the global financial crisis, and the growing disparity in wealth between the top 1% and the other 99%. The initial protest was in Manhattan, but eventually spread worldwide. Most of the protests were peaceful. However, a few protests did have violent disturbances, which were usually caused by those not involved with the actual protest itself. Civil disobedience is a peaceful form of political protest that includes the refusal to comply with laws. Occupy Wall Street had moments of civil disobedience, including when protesters took over and closed the Port of Oakland and set up tents in local parks. As a nurse, I see firsthand how those in lower socioeconomic classes are affected. Their health is poor because they have either never seen a doctor and are not aware of the diseases they may have, or they have seen a doctor but either lack the education or the income needed to follow the prescribed treatment plan, therefore making them non-compliant. How is modern society affected? Since those with similar socioeconomic status tend to live and work with one another, a form of social segregation occurs. As previously discussed, those in this group receive poor education, have a higher risk of disease, and have a higher risk of involuntary psychiatric commitments. Both discrimination and marginalization can create a barrier to those in lower socioeconomic classes from climbing higher up the economic ladder. If a person or family is able to break through the barriers and climb higher up the economic ladder, their opportunities and access to resources improve. Therefore, the education they or their children receive will be better. The health care available to them will be better quality, thus improving their overall health outcomes. They will have access to better psychiatric services, and the stress due to poverty may be lessened or eliminated. The stability of the family is likely to improve as well due to the lessened stressors. There can be many challenges to climbing up the socioeconomic ladder. Unfortunately, there are some people who believe no matter what they do, they cannot get ahead. In fact, according to an article called Class in America, Mobility Measured, a poll indicates only 52% of Americans believe there is opportunity for advancement. Since the gap between the rich and the poor has widened, it is that much further a person has to climb to reach the next level. And because the schools are of lesser quality, so is the overall education, therefore advancement is difficult. And like it or not, discrimination based on gender, race, and/or sexual orientation still exists and can be an impossible barrier to overcome. When the family structure is made up of only one parent, it can be very difficult for that parent to make any improvements, such as furthering their education, because they lack the support to manage the other demands in their life. Healthcare disparity due to socioeconomic status is a global issue. It began early in American history when European settlers divided immigrants, both coerced and uncoerced, into dominant and subordinate groups. This created a hierarchy and an inequality between the groups. Depending on the group one was assigned to, healthcare was either denied or very limited. Limited access to healthcare services and the quality of care available can be inadequate. Those with a lower socioeconomic status tend to lack good nutritional habits because health food tends to be more expensive. And they tend to exercise less because the cost of organized sports can be prohibitive, and recreational play can be dangerous depending on the neighborhood. Things like unemployment or inadequate income to cover the cost of basic living expenses can cause increased stress. Healthcare disparity due to one's socioeconomic status can have a significant impact on several factors, such as onset of disease, functional loss, disability, and death. Onset of disease. When a disease is recognized is dependent on when health care is sought. This can be affected due to a lack of health insurance or poor health care habits. Another issue is functional loss or disability. People in a lower socioeconomic class tend to have more labor-intensive jobs. Therefore, a disease or condition may cause them to be disabled, whereas that same disease or condition would not be disabling to someone who works in a white-collar type job. And finally, death may occur due to an unrecognized disease such as heart disease or diabetes. At this time, it's difficult to determine what changes will occur due to the new administration in Washington, D.C. If the Affordable Care Act is repealed, 9 million Americans will lose their health insurance coverage, and another 12 million Americans will be kicked off of Medicaid, thus eliminating any improvements that were gained in disparity. According to former President Barack Obama, the rate of uninsured Americans declined by 43%, from 16% in 2010 to 9.1% in 2015. The Affordable Care Act has shown improvements in both access to health care and overall quality of health for those with a low socioeconomic status. My recommendation is to keep the Affordable Care Act and make any adjustments needed to further reduce the number of uninsured Americans. Funding for both Medicare and Medicaid should not be reduced. My strategies for implementing my plan is quite simply get politically involved. If you are able, join a professional organization who has already voiced their desire to maintain the Affordable Care Act until an acceptable and appropriate replacement is developed. Such organizations include, but are not limited to, the American Medical Association, the Association of American Medical Colleges, the American Nurse Association, and the American Public Health Association. Contact both your state representative and senators and express your concerns or outrage to prevent the repeal. Sign a petition created by Organizing for Action, which can be found on the web at www.ofa.us/protect-Obamacare. Demand Republicans have a plan in place to replace the Affordable Care Act that will not be devastating to millions of Americans. I have already started to implement my plan. I have already signed the petition mentioned on the previous slide, and I have also written letters to my Maryland State Representative Steny Hoyer and my senators Benjamin Cardin and Chris Van Hollen, letting them know my position on maintaining the Affordable Care Act until an acceptable replacement is presented. And now I encourage you to do the same thing. There are several benefits that the Affordable Care Act provides for both patients and hospitals. For patients, the prescription drug benefit covers at least one medication in every class of drug, and the cost is then applied to the cap on out-of-pocket expenses. The preventative services benefit allows those in the low socioeconomic status to see a physician and receive medical testing before becoming ill, thus preventing the onset of diseases and reducing overall health care costs. Mental health services were not covered by most insurances before the Affordable Care Act. And both maternal and newborn care are required to be covered at no cost since it is considered preventative maintenance. Hospitals are rewarded when they can demonstrate improved health outcomes for their patients, as well as reducing the costs of the care they provide. The cons to keeping the Affordable Care Act include: there are many Americans who believe the Affordable Care Act is a violation of human rights, because you do not have the option to go without health insurance without paying a fine for noncompliance. Another concern is the cost of insurance premiums are higher for those with higher socioeconomic status. And some believe there is an infringement on religious beliefs because there is coverage for procedures and treatments which go against one's particular faith. And finally, paying for unnecessary coverage. For example, a single male paying for the maternity portion of the coverage that he will never use.